Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. Good morning. Today is Monday, June 17th, 2024. It is Mental Health Monday. However, we are here today to talk about a different perspective of health. And we are going to get a little input from our guest about a mental health perspective as it pertains to our pediatric or children, our young people. Our guest today is a young woman who started a nonprofit in the pediatric space for folks to get care, no matter their ability to pay. And about 2 or 3 months ago, I coined this phrase while at the School of Nursing for their Black Men's Health Summit. And I talked about medical capitalism. And so I find it so encouraging. And I'm happy about the fact that there was someone out here that is ensuring that our children are taken care of despite their parents' ability to pay. And, when they're able to, of course, she needs to survive. But before we bring our guest on, I just wanted to say two things. One, a blessed Eid to all of those that are celebrating. Thanks to Monica Zeno Martin. She told me how this is a lunar-based holiday. And so the date did change. We were talking about it last week. And also, I'm declaring it a national holiday. It is Brother Miguel Real. It is his birthday today. And so we would like to wish him a happy birthday. So he may jump in later on. If he does, everybody go in and say happy birthday. But I would like to bring our guest on and introduce the Java family to her. Do me a favor and hit that share button and tag people and invite them into the Java Cafe so they can hear this great information. And so without further ado, I would like to present to some and introduce to others Dr. Robyn Riseberg, who is with us from, and let me just right here. She is a young woman, again, that's moving in the space of ensuring that our young people get medical care. And so, Dr. Riseberg, if you could please introduce yourself to us, tell us a little bit about yourself, and then in one word, describe the state of pediatric equity in one word.
One word. Wow. Okay. No
pressure at all.
No pressure at all. I'll just sum it all up. So I'm Robyn Riseberg. I'm a pediatrician and the founder of Boston Community Pediatrics, which we opened in November of 2020. A really interesting time to open a new healthcare organization. And we are, as you said, a nonprofit, but we are the first nonprofit pediatric private practice in Massachusetts and one of the first in the country. And really started, I have spent my life working in community health my whole career, and really have been focused on providing the highest quality care to Black and Brown patients who, especially those with low income, who might not otherwise have access to that care. And it's been an incredible journey. I think I used to have to explain to people like, oh, our healthcare system is broken. And people would say like, oh, tell me more about that. And now people are like, right? Because it is. So if I wanted to talk about the state of equity in pediatrics right now, I might, I'm going to say, I know you said one word.
You can go ahead. You're fine.
I think it's a little bit, it's unraveled, right? It's in chaos. But I believe that we can fix it. And so I think that's why I created this organization. I think there's a bright future ahead if we can just go back to the patient and back to centering everything around the patient and what the patient needs and the family needs, and forget about all the rest of it, which is the bureaucracy and the noise of healthcare that is really ruining what it should be, the most fundamental human right that we are all, deserving of in the exact same way.
Absolutely. Dr. Riseberg, if you could tell us a little bit about your journey. I sense a passion. I sense an authentic, sort of concern in wanting to address this. And I sort of snickered to myself that, it's a problem that can be fixed. So it can. We just have to have it comes a new term, the medical will, or the provider will, or the system will, to fix it. And so if you could back up a little bit for me and just share with me a little bit about your journey. Were you born and raised in Massachusetts? Where did you train? And what was the catalyst for you where it switched from maybe going into, you may have went in, what either pulled you out of the regular medical system, or what propelled you to go into this sort of nonprofit in medicine? And I know most of our clinics and hospitals technically are multi-million-dollar nonprofits, but tell us a little bit about who, with all due respect, because you earned that degree, who's Robyn?
Yeah. So I grew up outside of Boston, and am sort of, this is like my home. This is where I've always thought I would be. And my parents were very interested in making sure that everyone in the community had what they needed, and taught me from a very young age that community is important, that helping those who might be less fortunate than you is important, and that everyone deserves the same dignity and respect that you would want. And that has really been a core center of sort of like how I view the world, right? I went to the University of Michigan. I was not pre-med. I never wanted to be a doctor. I was scared of blood. And then I traveled around the world, mostly in Southeast Asia. And I was a psychology major, and I wanted to be a sports psychologist. And when I was in India.
Hold on. Let me just chime in real quick. Sports psychologist, Game 5 tonight.
Yeah, I know. We're going to do it. Go Celtics.
Go back to the story. Sorry.
Okay. Yeah, they hopefully got a little bit of mental health help this weekend.
There's a whole psychology there. Yes, ma'am. Go ahead. Sorry. I heard sports.
But I think they really wanted to win it in Boston. That's what I think,
There's a whole debate on social media. We could do a whole separate show about the other night, and sports psychology, psychology. Go ahead. I'm sorry. Your story.
So I was in India and in the middle of Delhi, and was seeing the just huge poverty, huge amount of illness. And I thought, wow, if I was a doctor, I could probably help some people here. If I'm a sports psychologist, I'm not sure I'm really going to that might not be how I want to go out in the world. And that is, sports psychology is a great field. Psychology is an amazing field. I actually use everything I learned every day. But I went back to the States after traveling for 6 months with the backpack and going around, and ended up in New York City working for Planned Parenthood. And I was doing fundraising, and which is interesting because now that I run a nonprofit, I use everything also that I learned in that journey now. But I realized that working in an office and at a desk was not really for me, but I was volunteering in the clinics, and I was like, oh, this is amazing. And so I literally woke up one day and was like, I'm going to go to med school. This is what I want to do. This is how I'm going to, this is going to be my journey of helping the world. And I always thought I always loved kids. I always thought I'd be a pediatrician. But so I had to go back and do a post-bac program where I took all my science classes in 1 year at Bryn Mawr College. So I moved to Philadelphia. And
my good friends graduated from there, Jackie Prioli. Yep.
Yeah. And so it was a 12-month program, and it was just we always say, it's quick and dirty. You get everything that you need to get done. You apply to med school. When I was applying to med school, I moved back in with my parents to save money. And I was waitressing and also I had the opportunity to work at Boston Medical Center as a pre-medical intern under Barry Zuckerman, who is a well-known pediatrician leader.
Know the name. Yep.
Yep. And then I was very fortunate to go to UMass Medical School, which I absolutely loved, and got a wonderful education, and was very interested in advocacy there and did a lot of work in advocacy. And then did my residency training at Boston Children's Hospital and Boston Medical Center in the Boston Combined Residency Program. And again, was more focused at Boston Medical Center in this advocacy track there. And when I actually finished residency on bed rest, because I was having my first daughter and ended up needing to be on bed rest. But when I got back to work, I initially was going to do a fellowship, and I realized very quickly that I just wanted to focus on clinical care, and I wanted to be able to spend time with my daughter. And so I started working pretty soon after at the South End Community Health Center. And there was a man there who had started it named Dr. Gerald Haas, who is still my mentor, and you may or may not know of him. He's going to actually be 90 this summer. I just talked to him on the phone yesterday, and he's amazing. And he said a couple things to me when I came. He said, "Oh, we're going to have so much fun here." And then he also said, "Just treat patients and staff like family, and everything else follows." And that is something that I think is so true. And so I started working there, and I was a part-time pediatrician and a part-time mom. And I thought,
full-time mom. Let's correct that with all due respect.
Right. Full-time mom.
I don't.
Part-time pediatrician. And I thought, this is it. Like, I've done it. I've made it. I'm working it with the patient population I want to work with. I had learned Spanish before I went to medical school, so I'm speaking Spanish a lot during the day. I work with amazing colleagues, amazing patients, and we're really helping people. And then probably 5 to 7 years later, my boss left. Dr. Jack Maypole, and he went to Boston Medical Center, and he literally said to me, "You're in charge of the department." I said, "Oh, I actually don't want to be in charge of the department. I did not
want the admin."
Yeah, I didn't sign up for that. And he said, "Well, you're it. You drew the short straw. I think you're going to do a great job, and like, good luck." And so I stepped into this role, and one thing I always tell people is I didn't get paid for it, which I'd never do that again. Right. Because I was doing it, on a temporary basis. And after a year and a half of doing it, and I realized that actually I love kind of creating new programs. I helped to start a school-based health center at the Blackstone School, which was the only full-time school-based health center in an elementary school in all of Boston. I brought in care navigation to the pediatrics department. I actually brought in integrated behavioral health into pediatrics. And I was like, this is, of course, with the help of so many other people. I did not do this single-handedly at all.
Yes.
But I was like, I love this. I actually love creating programs. And I also had the ability to sort of protect my department from all of the noise /
bureaucracy. Yep.
Right. And so we were constantly being told, see one patient every 15 minutes, because our healthcare system is set up so that you can, just the more you see patients, the more you bill, the more money they make. And I would constantly say, I can't do that. And at 15 minutes, I'm at hello. I'm not at like, we're done, you know?
Yep.
But I'm learning so much about the patient. I'm hearing, kids talk with their parents. I'm asking how school's going. The kid says it's great. The mom says he's failing. And I'm like, oh, okay, let's see what's going on here. So I was constantly saying, no, you don't have to see a patient every 15 minutes because that's not possible. And I would run behind. I was an hour and a half behind always. And patients.
You said you were what?
An hour and a half behind all the time, because if you book me every 15 minutes, and I can't do that, I have families coming in telling me that their kid is failing out of school, that they are homeless and they don't know what they're going to do, that they don't know where their next meal is coming from. And what am I supposed to say? Like, I just treated your strep throat. I hope you have a great day. Like, that's not healthcare. That's not care. And that's not taking care of people. I don't even know what that is, but that is what we're being asked to do now. And so, ultimately, I realized that, the system was broken. I tried to change it. I tried to advocate for change. And I just realized I was never going to be able to do it within the system, right? Yeah. The system we weren't going to be able to work together. And so I started looking at models all over the country. I talked to people, I talked to anyone, and I was still running the pediatrics department at this time. And my spare time, I'd be looking at models, figuring out what worked, what didn't work. And I ultimately realized that what works in Massachusetts was small private practices. but small private practices mostly take private insurance.
Yep.
Because the Mass Health or Medicaid pays much less than private insurance. And so you can't make ends meet as a business if you're taking all patients with Mass Health. You need some other funding. So I thought, well, I knew what I needed to create. I know I needed like high quality mental health services that were truly integrated. I needed a care navigation and wellness services to focus on the social determinants of health and not give people a piece of paper. Like that piece of paper, not for me, but really help people.
Wait, hold on. Did you say not for me? Go ahead.
So I said, well, I can create all that, but again, and the 15-minute visit out the window. Our visits are 30 to 60 minutes long because you can't, in my opinion, you can't do anything in 15 minutes in medicine.
Yep.
And so if I created all that and I created it like a private practice, but I wasn't going to be able to run a business. And so if I made it a nonprofit, then I could use philanthropy to help offset the lower reimbursement costs and the lower reimbursements that we were going to bring in because our visits were longer.
So we're going to take a break real quick because I feed off the energy of my guest and it either makes me hype. And I say this with the understand this next part of it. It makes me just a little bit tired. And what I mean by that is I am so engulfed and engaged with the convo that when I stop, I'm like, oh, shoot. And so your story is incredible. And so we're getting ready to take a quick break and we're going to come right back. And Dr. Riseberg is going to continue to tell us how she's taken her experience and her story and her I just sense a very real passion around ensuring that not just the patients, but there's equity that now is there for the parents because they're getting tapped into services and this sort of wrapper. Dr. Riseberg, we're going to take a quick break and we will be back with you in 2 seconds.
What are you doing for Juneteenth? What you should do is join us for Historically Black Phrases Live. It's a trivia show based off the best-selling book by Jared Hill and Travell Anderson, and they'll be here in Boston on Wednesday, June 19th with The Emancipator and some special guests. Join us on Juneteenth at WBUR City Space for laughs, culture, and an overall good time. We'll have amazing guests such as Gullah scholar Sun Michaud, influencer Claudianne Philippe, and Boston's poet laureate, Portia Olayawula. Get your tickets now before they're sold out.
Hey, everybody. We are back with Dr. Riseberg, who is the CEO and founder of Boston Community Pediatrics. Boston Community Pediatrics. And if you were in the first segment and heard her story, first of all, I know I haven't checked the comments lately, but I can guarantee you that by the end of the show, are you taking patients? Are you taking patients? Is she taking patients? Is she taking adolescents? By any chance, is she working in adult medicine?
No adults.
And so you've had this experience. You started Boston Community Pediatrics. And what is it that you see the impact? What is the impact that you're having? And I have to be honest with you. I had this thought in your introduction. We're in Massachusetts. One of the most liberal, I was going to say equitable, one of the most liberal and aggressive states when it comes to sort of universal health care. You know, President Obama took our model, blah, blah, blah. But I'm hearing that there's still a gap.
Yeah.
Where is that gap and how are you filling it?
Well, the gap is that I think we're really not focused on patients all the time, right? We're focused on the bottom line, and we as a system, right, as a healthcare system. And there's plenty of money in healthcare, but it's not always going into the right place, right? So, primary care the money that we focus healthcare put into primary care is about 5 to 6% of the total healthcare budget. There's nothing more important than primary care.
Say that again, 5 to 6 of the
total healthcare budget. This is nationally goes into preventative primary care.
5 or 6, not 56.
No, 5 or 6%, 5 to 6%. Yeah, I know. It's unbelievable. And that's because, right, we're always dealing with like the emergencies, right? The crisis, the people who are so sick. And then if you want to look at what goes into pediatrics, it's even less than that, because kids are cheap and people don't focus on kids. People focus on more expensive adults. My argument is always kids become expensive adults. And if we don't make a change now, like, we've lost a huge opportunity. Right? Kids are our future.
They're our future and our present. And I'll be honest with you, as we were doing the countdown to come in, I'm sitting here thinking, and I'm like, wow, this is great work, because if you keep the children healthy as children, more than likely they're, hereditary, diseases and comorbidities and things like that, but can still be addressed if you get it at early onset or early stages. And then more than likely, you have a higher percentage of these healthy children, healthy teens becoming what? Healthy adults. Right. It just makes sense. And so you talk about the gap with primary and preventative care. Go ahead. There's just things that you're saying that I've had thoughts about with different guests that move in this space and haven't been clearly able to articulate them like you do. Go ahead.
Well, so just to give you some examples about how we're addressing it. So our mental health care is completely integrated with our primary care. So I'm going into mental health visits. Someone comes to our office for a therapy appointment. I'm actually in their therapy appointment. Their pediatrician is in it. And that's because we know that mental health care and physical health care are completely related. And so if we do it separately and there's no communication between the providers, we're really not helping patients. And also we're asking people to repeat their story. So I'm going in and I'm titrating medication. So if you're being seen for depression and I'm the person who's prescribing your antidepressants, or if you're being seen for ADHD and I'm the person prescribing your ADHD medications, when you come in for your therapy appointment, I'm going to go in and make all the changes there. So your mental health clinician, you, your parents, and me are all on the same page. We're hearing everything at the same time. You don't have to make another appointment to come see me to tell me the whole same story all over again. And possibly
wait, hold on. That creates another visit for more
another
money.
Visit, another time you have to miss work. A kid has to miss school. We're not like, that's not putting the patient first, right?
Absolutely. I was being sarcastic about. So you're intentionally not creating this other visit to generate more revenue for the business versus you're going back and, as you said, you centered the patient.
Yep. And then we're also breaking down barriers. So I had one of our teen patients, her therapist referred her to Future Chefs, which is this great after school program.
Yep.
And so she was there and they had their Small Plates annual event where they asked her to get up and speak. And so she got up and spoke about how they wanted her to tell her story about how she got to Future Chefs. And so she said, my therapist recommended I check out this. Therapist was, one, in the audience listening to her. And two, this is a Latinx teen who's standing up in front of a room full of people she doesn't know, telling people that her therapist recommended that she do this. Like, it's not a big deal to have a therapist. Like, everyone has a therapist. And breaking down such stigma and barriers. And especially within the Latinx community, there's a lot of stigma around mental health services. So she spoke beautifully and everyone was like, didn't she speak so beautifully? I'm like, yes, but like, she just said her therapist recommended her. Like, she's 15 and she is saying this. And this is exactly what we're trying to do, is break down these barriers. That's why people get their mental health services on site in our office. So that's one thing. Another thing is when people come in, everyone gets many things that they need. So that we give out food, hygiene products, feminine hygiene products, new underwear, clothing, and books. And all of this is just part of the visit. So we don't say to people, we do ask people, if they are feeling concerned about food, housing insecurity, having issues with utility payments, transportation, and then we're going to help them. But we just assume that everyone's going to need this because right now everyone does. And if you give it to people we give it in our beautiful blue bag and we just say, here's for you, or what size diapers, what size, underwear. And then people can decide to take it or not. And everyone takes it because it's all new and beautiful things. And it's really, again, most of the time in healthcare, we're saying, oh, you can go here and get underwear. You can go here and get clothing. You can go here and get food. Like, who has time to do that? People are working 2 jobs, 3 jobs to just make ends meet, taking care of their children. It's not something that you can possibly do. And so we're providing it all on site. And then we have our care navigation and wellness team who is like digging in with families and saying, okay, you're having trouble with housing. We're going to do a housing application with you. So they're going to sit in our office, do a housing application with you. And then you can do it on your own. And if you have trouble, then you come back and call us. But we're not saying like, here's a piece of paper, like sign up for these housing lists, because that's really hard to do. And they're hard and complicated, and no one makes anything easy around here. You know, we're helping families get on the low income utility discount. Now, why people aren't automatically put on it? If you live in an affordable housing community, you have low income. So why aren't you on that discount program? Like, that's really messed up. And then we run all these programs after school where we help kids can come in for a tutoring program, a reading program, a dance program, a Girls on the Run program. And our biggest and best is our cooking class, where we send food to families ahead of time, always with a fruit or a vegetable as the main ingredient. And then we cook over Zoom and in person. And we can have like 35 kids on Zoom cooking kale and eating kale salads.
I've been stumped a few times in the past 4.5 years. This one is different. Are you on any local pediatric health equity task force, advisory policy committee, something?
Yeah. So right now I'm actually working with a group around mental health care and trying to figure out what is NEHI, what is the sort of best path forward for integrated mental health in Massachusetts. And so I'm lending my view of that. And it's a group of providers and payers. We actually have our meeting this afternoon with bringing the providers and payers together. So that should be really interesting.
Very much so, but I'm going to challenge you. We need to, and I got the governor on tomorrow. Dr. Robbie, I think it's Robbie Thomas, who's the new head of DPH. Like, you need to be on his radar, because what I'm hearing from you is the experience, the passion, a level of know-how, and understanding of the community you're serving. And we need this philosophy to, a good friend of mine uses this word, to soil. And you know, when something is soil, it's in every fiber. It's hard to get out. We need to soil the medical industry around the approaches that you're taking. One thing I want to ask you, and I have a wide range of folks that are part of my audience, and she asked this question earlier, and I'm sure to some extent you've kind of answered it, but how do you evaluate your impact? I'm sitting here and I'm like, okay, there's presumed impact. There definitely is, but is there a form of evaluation that you use with your patients? And also, Diane, I think she's from Medford or Malden. Dr. Riseberg, I'm curious to know, in what ways are people with lived experience, patient, parents, informing, implementing, and evaluating your program?
Yeah, it's a great question. So we are and currently have it ongoing right now. We have a patient satisfaction survey, which we developed in kind of collaboration with an organization called Listen for Good and with support of the Boston Foundation. And so we ask our patients, do you feel listened to? Do you feel heard? In the literature, it's well known that about 50% of patients with low income say that their provider listened to them and explained things clearly to them. We asked that exact same question of our patients, and 100% of patients said that they feel listened to and heard. And so we are asking them, what do you want? What do you need? So last time we did this last year, because you don't want to do it too frequently, but you want to do it enough that you can actually then inform your programs. People said we wanted dental. So guess what we have now? We have BU Dental School coming here once a week, providing dental services in pediatric exam rooms. So we have portable dental chairs. And so once a week, our patients can get dental care. And so you could be here on a Tuesday. You could have your physical, you could get your dental care, you could get help with housing. And then we also are doing things like signing kids up for camp, because I don't want kids on their phones this summer. I want kids having enriching experiences together in community in high quality places like Camp Harborview or United Southland Settlements Camp Hale or Camp Wonderland, many, youth enrichment services, Phillips States Brooks House. Like we have so many partnerships in the community to get kids out and doing great things.
Dr. Riseberg, when I get off of here, I'm going to have to go somewhere and pass out. Because it is just, I'll be honest with you. We move a lot in health equity, and we talk about all the adult issues, and we talk about the system. And I thank you for reaching out to us, because we met with some pediatricians during COVID, the vaccine. We've had some pediatric psychosomatic therapists, in the room with us. But to this level of, one, understanding this is a resource available to folks, and two, to just know that someone is at the helm that adopts this real equitable philosophy in centering the patients, and also the parents are automatically, getting services out of this. As we get ready, and I can't believe it's 9:35. So that means there's another sign that this is good. Are there any challenges that you're facing? What are sort of the challenges that come with this? You mentioned donations and philanthropic organizations supporting. How can we help?
So the one of the two challenges. So one, getting it funded, right? And so we do have to raise a lot of money to get it funded. And two, which goes along with this, is figuring out how the healthcare system can pay for it, right? Because this is health at its broadest. And it's the way that it's the only way I think you can look at health, because I think if you look at health, narrowly, you're missing actually what's important to patients. So that question about like, how are you centering patient voices? Every day I listen to patients, right? I didn't create this because I was like, oh, I think this is needed. I created this because I saw how frustrated patients were. I saw how frustrated I was, but most importantly, I heard what patients wanted and needed and what was important to them. I didn't say, oh, I think this is a good idea. And so we are constantly asking our patients, like, what do you want to see? What do you want to do here? And and so if they have ideas for programs, we're going to try and bring them in. But really kind of navigating and advocating with the healthcare system. Everyone's talking about this is how they want healthcare provided, right? The accountable care organizations in Massachusetts are getting paid extra for doing this type of work. We're not part of one yet. And I don't know if we'll ever be part of one, because we need our independence to innovate and disrupt the system. And so I want the healthcare system to pay for it, because I'm doing their job, right?
Yes. Sorry, just a little distracted. Guess who I'm emailing while we're talking?
Who's that?
The commissioner of DPH.
Oh, good.
Yo, bro, you need to bring this woman into your department and figure out how to get you in a pediatric space. And of course, there it is, mail. I'll do this after, because I know me, I have ideas during the show, and then the show goes off and I'm like, crap. So I got this up here. We'll get this set with Dr. Robbie Goldstein, not Thomas, Robbie Goldstein over at GPH. Jesus Lord, DPH, all these acronyms, you get it in healthcare and in government. And so do you have an event coming up? My audience is very into action when they see folks like this. And I did, for folks to know, the link to the website is right here. And over to the right-hand side is a little white button with black letters that spell DONATE. Donate. And do you agree, and do you solicit $5, $10, multiple? Anything helps? Anything helps.
Absolutely. And we, I'm happy to talk with people. I'm happy to help. We want this to become the standard of care in healthcare, right? We want this to become the standard of care in pediatrics. We do have an event in November. It's not fully announced yet, but we are going to do a
we like to drop news here. Tell us about it.
It's going to be an educational event, not a true TED Talk, but a TED Talk like event, right, about this work, and just getting people engaged and understanding, like, in a deep way, what this work really is and what it actually means for patients and families to be able to access care like this. Like the other thing that I always like to talk about too is access. So if a patient needs an appointment, that was one of the things also that spurred me to start this. I would have, moms who are trying to get 3 kids out the door to 3 different Boston public schools with 1 kid sick, trying to get on the phone, be on the hold for an hour, only to be told there wasn't an appointment. Like that's not equity. That's not healthcare. I don't even know what that is, but that's our system, and so
it's the system. That's what it is.
Right.
Yep.
So we answer the phone. So someone is, and if you need to come in, if your child's sick, we're going to see you, right? And someone's going to call you back. If we miss the phone call, which is rare, we're going to call you right back. We're going to get you in. We are like, that is who we are serving, and that is why we exist. And so if you can't get an appointment when you need one, we are going to do a telehealth appointment if that's all you can do. We're on call 24 hours a day, 7 days a week. So I have literally been in my bed at midnight worried about a kid that is having trouble breathing. And I'm like, we got to get on a video call right now, because I need to know if you have to go to the ER, if I can see you tomorrow morning in my office, because that's the work that's what you need to do.
But this is the old model of sort of the house call, just, electronically. And in 2024 now, I just wanted to acknowledge a comment that my brother made over on Instagram. While that was deep, how do you evaluate your impact? That should be a model everyone subscribes to. There are other comments from Michelle D. Smith, Dr. Riseberg, muchas gracias for all that you're doing to be a change maker in the healthcare sector. Definitely look forward to supporting your cause to provide equitable healthcare in pediatrics, and hopefully eventually patient focus and equitable healthcare for everyone. The adults are jumping on this. They're like, wait.
I know. They all want to, I know people are like, where can I go to find this for adults? But we are still about, back to the evaluation. So that's one thing we're doing is the patient satisfaction survey. And then we actually have hired an outside evaluator, Health Resources in Action, to help look at our model.
I know them. I got a lot of certifications from them years ago. In the health space.
Yeah. So to start working on it, and that's just the beginning, because we know we have to keep evaluating how we're doing. But like, for instance, our no-show rate is 10%. Most community practices is about 30%. That's because we answer the phones, we see people when they need to be seen, and then we actually will even Uber someone. Like if you are desperately need to get here and you have no way to get here, we're going to send an Uber for you. People are always like, how'd you come up with that idea? I'm like, well, if I needed to get one of my kids somewhere, I would Uber them somewhere. So it's really, it's very basic things. If you really just go back to the basics, think about how you would want your own family to be taken care of. That's just what we do.
Dr. Riseberg, we're a little bit over time. I think I turned Alexa off. There's a reminder that comes on in a couple of minutes. It's a whole thing joke here with the audience. I am hopeful. I'm inspired. I'm encouraged. And a little, the activist in me is heightened because I just don't understand the disconnect between folks like you and influential task force spaces, committees and whatnot. The payer and the payee, that's wonderful. And you can make recommendations for policy, but you need to be on somebody's gubernatorial, governor's, healthcare, NIH's, HHS's, Administration for Children and Families, something, because we need this. I will go ahead and state, you serve a lot of Black and brown folks. You are an ally. You are a white woman. And since 2020, there's been this, conversation about what does allyship look like? Well, Jesus, if allyship was one of a picture, we got a nice snapshot here today. I just,
thank you.
It's someone that talks and moves about moves in this space. I just, again, encourage, inspired. The activist is a little tweaking in me because I just, this message, this philosophy needs to soil medicine at like every level. You need to be speaking at conferences and the AMA and ACGME and all that other stuff.
Yeah.
We'll
get there.
It's coming. Yeah. And if I can help promote, because we're definitely going to take some clips up out of here and put them on social media. Monica Zeno Martin is saying, need to connect clinicians and parents that I am connected with through the Boston Community Pediatrics, especially regarding early relations.
Wonderful. Yeah.
That's so Monica, there's going to be a whole bunch of emails going out after this show. Did we cover everything? We have the website that is where folks can go and get information. If it's easier, do you think, should we put a phone number up as well for them to call? You let me know how folks can reach out.
I think the website is, we are accepting new patients. The website is great. And there's a way to email us on the website. It's just info@bostoncommunitypediatrics.org. And so that's our best way to kind of filter through.
Yeah. Because you got to keep a record document. And
also just like who's the right person to answer what questions, right? But I want to invite you, Jimmy, to come visit and see our space because it's all brand new. We started in 2020 with 12 staff members and 150 patients, and we now have grown to 20 staff members and over 1,500 patients. So we're growing wildly. We're invested in this work. We're invested in our staff. It's really important to me that we invest in staff as well. And we're invested in our patients. And we're truly invested in this work. The other thing I didn't quite mention is we do have like 4 special events a year where one was, we had a camp night where we brought in all these camps and we're signing kids up and sending kids to camp and, paying the camp fees if they need to be paid because kids need to go to camp. Then we have a back to school event in the end of August where we give out backpacks and school supplies and everything that kids need to start the year healthy. Last year, actually, we partnered with the Pedro Martinez Foundation. That was fun. Pedro and Carolina came to the event, which we held at one of our partners, the base. And so that was awesome. And then for Thanksgiving, we give out 300 turkey sides, pies.
Turkey sides, pies. I like
everything
that.
You need, produce. Always fruits and vegetables. My thing is always fruits and vegetables, right?
Yeah.
Stable food, winter coats, because we know when you talk about mental health too, mental health plays a role in all of our lives pretty much all the time, right?
Mental health is health.
Right. And these events, Thanksgiving is supposed to be this wonderful, happy time, but it's not wonderful and happy if you can't afford the things that you need to provide for your family. And so we just tell everyone, this is what we have. The parking lot across the street from us, we give it out. And then for the holidays, we set up a winter wonderland shop where families can come and actually shop for Christmas presents. And then we get them wrapped by volunteers. We have Santa there. We have books, Curious George, stocking stuffers, all sorts of things to make it just a joyful time and not stressful because you're going to get the presents that you need for your families, which is really stressful, right? And we're trying to eliminate that stress because that stress also filters down on your kids, right? So come visit, Jimmy.
No, I will. And the interesting thing is the last place we had a show, I went to Mission Grammar School and they're about to be adopted. I've never thought I would adopt a school, but so when I go visit, things happen. And so I would love to come and see it. And at the same time with, checking with the patient or whatever, I would love to chat with the patient, about
Absolutely.
the impact. I'm stuttering. So that's a sign. Just very inspired by this. And again, the dear Robbie and Michael, I had Dr. Robyn Riseberg on the show today. When I tell you her and her program, Boston Community Pediatrics, that's as far as I got. And so I'm going to finish that email and get that because you definitely they need to come and see what's going on there. It is just so amazing. So amazing. And so Dr. Riseberg, behind the scenes, we'll figure out how I'll come there. We'll bring a little team and do some recording and talking. This is just amazing. And so folks, before we give Dr. Riseberg her last words, we're going to take one quick break again, and we'll be back with you in just a couple of seconds as we're talking with Dr. Robyn Riseberg, who is the CEO and founder of Boston Community Pediatrics. And if you're just tuning in, you need to go back and watch the after watch once we end. We'll be right back with you in 2 seconds. Thank you. Hey, everybody, we are back getting ready to close out listen, this is good for my mental health on Mental Health Monday. And so I just want to thank you for being with us today. And again, remind folks that the website is in the comments there. And also we'll put the email up right after that. But Dr. Riseberg, you are definitely a gift to medicine.
Thank you.
And we need to ensure that folks know who you are and what it is that you are doing. So there is the email address, info@Boston Community Pediatrics. That's the email. And you can also follow them. You can, I'm sure you may be on social media, but you can.
No, we're on Instagram and Facebook.
Okay.
That we're pretty active. So if you go to our Instagram, which is just at Boston Community Pediatrics,
yep.
You'll definitely learn a lot about us. We're always posting about like the work we're doing in the community with patients, patient stories, a whole bunch of different things. We actually just won an award. We won an award for from the Mass Nonprofit Network for the 2024 Excellence and Innovation Award, which was really exciting. And we brought all of our staff there. So 18 out of 20, not bad, staff members joined us when we got this award. And again, because staff sort of mental health, staff engagement, and just kind of really supporting our staff is critical to the work that we do, and making sure that we're trying to avoid burnout, because in healthcare, we hear about that all the time. And I think the way to do that is really, again, treat staff like family. It goes back to Dr. Haas and how you just want to take care of people and in the way that you want to take care of yourself. So.
Yeah, you give me a whole inspiration to take better care of myself as well. I have to admit, we have a whole group in here we call the Mothers Board. And where is she at? Sharon Cornelius. That's our little thing that we say here. She said, Doctor, sure wish this was the same standard was there for here for adults, more so for seniors. And so there's a model here. This can be this can transcend into cardiology. This can transcend into so many spaces. This model needs to transcend into clinical trials. Yeah. And you understand that whole aspect about the more data set you got.
Yeah. Dr.
Riseberg, with all due respect, get off my screen. Because we're good. Anissa and I will get this set up. I will be glad to come, and if you have a day that's the busiest, I will be glad to come on the busiest day and just be able to see this in action. With all due, I know this is real. Hearing about it is one thing.
Yeah, seeing it is another. Yeah.
So, and Sharon also said, I'm not surprised that you received an award. Miss Teresa also said, congrats, not surprising at all. My mother, Mama Java, also said, congratulations. And I just want to put this here. Naraki put it. And again, you moving in a space of equity in this time is very interesting. You talk about mental health and stress and things like that. And so Pastor Jordan said, protect her at all costs. So mothers, add Dr. Riseberg to the prayer list, her and Boston Community Pediatrics, because this is ministry. And with that being said, I'm going to get you off my screen before we go a whole nother way. Dr. Riseberg, thank you for your team, Anissa, for doing getting this together in the background. We're here. And I put something in the private, just make sure, because I think I may have emailed with your team and may not have your direct email. Please make sure I get that.
Absolutely. Yeah.
I got the email I need. And Monica, if you're still listening, I'll text her. Please text me the email address so I can hook you up with Monica, who wants to integrate her young people around relationship sort of health as well.
Awesome. It was so wonderful to chat with you. Thanks so much for having me on your show. This was great.
I did not know. Dr. Riseberg, I'm tired. So I'm ready to get off of here. You don't wore me out. I need to go see a pediatrician now. That's been a long time. Thank you so much. And the program that you'll need to look out for from Monica is called Parenting Journey.
Yeah, I'm familiar with it. That's great. Yeah. Yeah.
So already a connection there. Last thing, because I want to give you your flowers. Dr. Riseberg, you and your team at Boston Community Pediatrics, stay well and keep up the excellence in all that you're doing. Sharon Cornelius said, yes, indeed, it is ministry.
Thank you.
Dr. Riseberg, thank you. I'll be saying that again in 10 minutes if I don't get you off here. Thank you so much for being with us.
Thanks so much for having me. Have a great day.
Absolutely. You too.
Thanks. Bye-bye.
Folks, Java with Jimmy, Boston's #1 community platform, bringing you the information you need. All right. Just a few announcements for everyone. Tomorrow morning at 9 a.m., we have guests coming into the room all week this week. You won't get a Java with Jimmy, just Jimmy this week. A couple of things. First thing, tomorrow morning. All right, let me just put this here. Of course, where is it? There it is. Where did I put it? Just getting my notes for our guest this week. And so tomorrow morning, coming into the room is the Honorable, someone told me, is it Her Excellence? She's the governor. I believe it's her. The proper political protocol salutation is Her Excellence. Governor Maura Healey will be with us at 9 a.m. tomorrow, and we have a lot to catch up on. It's Pride Month. I will venture to say that I am potentially the governor's, who is a basketball player. I'm probably her first in-person or live interview after tonight with the Celtics. So, yeah, trying to stay focused. The governor is coming in tomorrow morning at 9 a.m. And then on Wednesday, as I shared that video, we have the folks from the Emancipator is putting a wonderful event together. And it is taking place on Juneteenth. Oh, God. June 18th and June 19th. Another one of those days with 80,000. I have like 4 invitations for Juneteenth night. I have my own event on tomorrow. There's a white party tomorrow. Just interesting. And so tomorrow we have the governor. On Wednesday, celebrate Juneteenth with a vibrant evening of culture and entertainment as the Emancipator presents historically Black phrases live, a national tour, and a Black culture show. That's taking place on Wednesday evening at City Space over at BUR. So make sure you check that out. We're going to have some of the information up on social media very soon today. And also on Thursday, discover the remarkable journey of Elise Sherry, CEO of Blue Hub Capital, I need to hook Dr. Riseberg up with this guest, a leading nonprofit community development finance institution. For over 27 years, Elise has driven Blue Hub's mission to invest $2.8 billion in affordable housing, job creation, and foreclosure prevention across 23 states and DC. And so they'll be with us on Thursday. It'd be awesome if they come into the Java Cafe with, I got a nonprofit we can talk to. But anyway, that's the rest of our programming for this week. One special announcement tomorrow evening at 6 p.m. We are debuting the first recording. I will not be going live. We will debut the first recording of Black Java. No sugar, no sugar, no scream. No sugar, no cream. And I am elated to have guests Keithan Foster and also Kaijon Freeman, otherwise known as Free. They're going to come and talk with us about the industry. And these are two brothers that are in it. Keith doesn't run around and talk about it a lot, but every time you see her, the artist on TV, he's in the background playing the bass. Very humble brother, both of them. I'm going to talk with them tomorrow, not only about their journey in the music industry, when I got at 10 o'clock, we're going to also chat with them about the programming that they're doing this summer, a 3-day intensive on June 17th through 19th. So more of them are, more information about that program is coming out on tomorrow evening at 6 p.m. And so if you would like to attend Black Java, email us at info@JavaWithJimmy. info@JavaWithJimmy. I may make the space public later, but right now it's I'm keeping a small group as this is our first episode. Michelle D. Smith Java with Jimmy fam, send up prayers and all your positive energy toward our beloved Boston Celtics to win Game 5, these 2024 NBA Finals to finally clinch the championship 18. I know that's right. Belinda is selling Juneteenth t-shirts, so please check her out for those. That's it for me. Pastor Marion, thank you so much for that acknowledgement. James, your community service programs are phenomenal. I appreciate it. Naraki, thank you for the note about our governor. And I got it 10 o'clock, so I got to get off of here. You all have a wonderful day. UCB, it's not 10:01. You get your whole hour, and we'll talk to you guys soon. Have a great day, everybody. Peace.